I'm Joe Halco, Director of Community Relations for Northwestern Counseling and Support Services, and welcome to another episode of NCSS Here for You. Each month on this program, we discuss a human services topic of interest to local residents, and we do that with staff from one of the three direct services divisions that make up NCSS, as well as with administrative staff and other outside organizations who we collaborate with throughout the course of the year throughout Franklin and Grand Isle counties. Now, this month's episode is titled Mental Health First Aid. Did you know that 1 in 5 people throughout Franklin and Grand Isle counties currently seek mental health assistance throughout the course of a year? Do you also realize that there's been a significant increase in prescription drug abuse throughout the two-county area? Mental Health First Aid Training is a program aimed at reducing the stigma of mental health for people who live with it and for the community at large by educating people about the importance of early intervention to prevent a mental health crisis. To discuss the Mental Health First Aid Training program in greater detail, I'm extremely pleased to introduce my panel of guests this month. And they are, from my left, Kevin King, who is the registered nurse for Northwestern Medical Center in their emergency department, Michelle Consejo, who is a legislator here in the state of Vermont, Linda Chaim, who is the Director of Special Education for the Franklin Northwest Supervisory Union, and Ted Mabel, the Executive Director of NCSS. I'd like to welcome all of you to the program this month.
Thank you.
First of all, what is mental health first aid?
Well, Joe, it's analogous to physical health first aid. You notice how often we train people in terms of how to care for somebody if they've fallen or if they've locked something in their throat or something along that line. This is a takeoff on that kind of program, but only applied to sort of behavioral health or mental health issues. The whole idea is that often neighbors, community members, community stakeholders identify problems and suffering that people may have way before they get treatment. So the idea of mental health first aid is being able to identify and spot certain behaviors that people may be experiencing, such as depression or suicidal thoughts, to be able to identify them, to learn what would be an appropriate intervention for them as a good neighbor or support person, and how could they refer them to appropriate services. And so the program really focuses on training community members, a cadre of community members that would be out there to support their friends, their neighbors, and their community. And the program really focuses on 5 main areas: depression, anxiety, substance abuse disorders, eating disorders, psychosis, and we've even added an additional one, childhood disorders. So people receive about 2 hours training in each of these modules to be able to go out in the community and support the professionals in their work.
And how extensive is mental health first aid throughout the state of Vermont?
Actually, this program here at Northwestern Counseling is the first in the state of Vermont. It's a movement that actually started in Australia, and that's where the fidelity of the program was really developed, and the original research. And then it's moved to North America and Canada. And we are the first ones in Vermont to develop such a program. We've trained 24 people, I believe, in this community to be able to go out and offer trainings throughout our community, and then hopefully throughout the state of Vermont.
So Franklin and Grand Isle County residents will be the first to benefit from this program in Vermont. This is yet another example of NCSS bringing innovative programming to the area in an effort to create a stronger community, one person at a time. Why make this investment at this time?
Well, I thought for probably 3 reasons. One is we're in an era of really tough times and government cutbacks and having to cut programs. So it seems the appropriate time to try to enlist and create I think, a cadre of support people to be able to help us in our work in the community. That's one reason. A second reason is that the demand for our services is far exceeding our ability to meet all the needs in this community. So the more that we could do to develop people who can support their friends and neighbors in the community, we would find it helpful to form partnership with us. And then lastly, I think it's fair to say there's stigma is a huge problem of preventing people from accessing services. I've just received some information in the last few days in Haiti. We know the disaster in Haiti, and there's tremendous problems that people are experiencing in Haiti. But in their culture, asking for or receiving any kind of behavioral health, psychological support and counseling is really antithetical to their culture. And so it's impossible to be able to offer that kind of service. So it's probably, we think, by getting more people involved in working and supporting their community, it will help reduce the stigma to be able to access services.
Okay. And tell us about the choice of trainers and the training that they went through to become certified this past June.
Well, what we did, the training is sponsored by the National Association for Behavioral Health out of both Denver and Washington, D.C. And they're going around the country to develop a 5-day training session. We were limited to, I believe, about 24 people in the session. So what we did, we took about 12 slots for Northwest Counseling staff, and then we opened 12 slots up to the community at large. And so we targeted, as you can see in the table today, educators, medical center people, legislators, law enforcement, a good number of special educators and other educators in each of the school districts. Because what they have learned to get this kind of program accepted is that you need to probably co-facilitate the training. So if you're doing a training with educators, to be able to have somebody like Linda be part of the training, it will be received with in a more acceptable, credible way.
Sure.
So we're trying to get a diversity of professions in the community to begin this initiative.
Anyone else have anything to add to that as far as?
Sure. In my case, first, I want to thank Ted Mabels for giving me the chance. I think it was a tremendous opportunity to learn more about it. As legislators, we have to make decisions concerning budgets and concerning where the money goes, especially when there is not a whole lot of money. I took this training as a chance to educate myself, not only on the problem that people with mental health issues have and how we can help them, but also understanding how we could save a lot of money by doing a lot of prevention. And when Ted mentioned that the resources are limited and without the involvement of all of us, including people that don't get paid to do this, that's how we're going to get out of it. So in my view, it was very important to have at least one legislator so we can understand and I can, get the message out and hopefully
Absolutely.
make it work.
Kevin, did you?
Well, I did notice that Ted must have done his homework for this because it seemed like there was a wide cross section of the community out there in the class. So, like you said, the educators and also the correctional facility, different areas of the community that could be affected. And it was good to see that wide range of exposure.
I agree. I think that was very valuable because there was a lot of cross-pollination between different professions and different disciplines as we went through the course together. So that was very helpful as well. Yeah.
It was interesting when when I first heard about this kind of program, I got really excited about it. And I brought it to my board and various groups, management groups, and people were quite cynical about it, saying nobody is going to sign up for this, who's going to do this? Why would people want to come to something along that line? So I got a little gun shy, and I kind of kidded around saying I'm not feeling the love and trying to push this through. But what kept me encouraged is the lower I went into the organization, as more I talked to frontline people, the more support, encouragement I really got. So I really kind of went against the grain of the advice and kind of took the shot for it. And we really lucked out because we got a lot of applicants. I think over 100 applicants for the 12 slots. So we're excited and very appreciative. And it turned out to be a great group of people.
And you know what's interesting about the cynical aspect in that is yet people in their daily lives are more prone to run into somebody who's dealing with a mental health issue than they are with someone who's about to have a heart attack or something along those lines. So, but yet they wouldn't view it that way, I'm sure. You know, they would think more of the, from the medical community's perspective of someone who has, whether it's a heart condition or, you know, something else along those lines. So.
And if I may, to some extent, I think that's part of the stigma.
Yes.
You know, stigma takes many forms, ways, and shapes, and that what Ted was describing is part of the stigma. Is the fact that it's never happening to us, it's never happening to our family, but mental illness goes across wealth, goes across education, goes across a lot of very wealthy, educated people have mental health. Part of the stigma is first to say, I may know somebody that has mental health, or I may have myself mental health, and to seek the help. And I think that's what we're sitting on that table, is to make it better for those people.
That's something I think that was so valuable in having Ted bring this program to this community is that after taking the training, I really realized that it's a continuum, and mental health, you know, can exist a little, a lot in each of us, our friends, or whatever. And it just really drove that home. If you're saying a 1 out of every 4 people during their lifetime could develop some form of mental illness, and it is more, you know, more likely than cancer, lung disease, or heart disease all combined, that can happen, then you're going to run across that, not only in your family, your workplace, somewhere in your lifetime, for sure, if not yourself.
Build on what Linda was saying, this is really a prevention program. You know, it's interesting, the field of prevention and primary prevention originally started out of the National Institute of Mental Health, but the field of community mental health has not really ever done much in prevention. We've really sort of been in the heavy-duty treatment business. And this really goes downstream a little bit, and being able to say, okay, neighbor helping neighbor, you know, by giving them some skills can make a big difference in people's lives. One of the things, for example, in Franklin and Grand Island, there's been a big spike in suicides, for example, in the last year and so we do a debriefing on every one of them. And in every case, because that's sort of one of the ways we evaluate ourselves, in almost every case, the person who committed the act was not known to us, was not a client to us, but was to somebody in the community. That's right. And so it tells us, going downstream by working and supporting people, the neighbors, I'm sure there's a neighbor in every one of those cases that was familiar with a situation that could have intervened and maybe done something in that person's life.
Now, you may not be aware, but NCSS provides services to individuals and their families throughout the entire life cycle. We'll continue our discussion about mental health first aid training after this NCSS